AIDS stands for Acquired Immune Deficiency Syndrome. It is caused by the HIV virus, which is human immunodeficiency virus. The virus attacks the T lymphocyte white blood cells and makes it so that a person cannot fight off various infections.
When it first came out, not much was known.
This year, in the United States, 42,000 people will become infected with the virus that causes AIDS. AIDS is an incurable disease that is the end result of infection by the human immunodeficiency virus, or HIV. An individual who contracts HIV can become sick quickly or live symptom-free for years, depending on how bad the virus really is.
Eventually, untreated HIV leads to acquired immune deficiency syndrome, or AIDS. The name is appropriate. Acquired means to obtain an infection, immune deficiency refers to weakness in the immune system, and syndrome is a group of problems that comprise a disease. Simply put, HIV attacks and destroys cells in the immune system, much as an invading army might destroy a high wall that protects a city.
HIV and AIDS are very difficult to live with. They are very difficult diseases that make it impossible to function in the human body.
It was first known as a gay disease, and they were still trying to find a cure. They didn't know a lot about it, so there was a lot of deaths behind it.
San Francisco's Castro district has become a little more heterosexual, a slightly upscale shopping street, since the days in the 80s and 90s when AIDS was devastating the gay male population that gathered here.
I've been around for the entire epidemic. The only thing I can liken it to is a war zone, but most of us have never lived in a war zone, but you never knew where the bomb was going to drop.
I remember looking in the window of Star Pharmacy, and there were these little Polaroid photographs that this young man had made of himself. There were at least 3, maybe 4 of them. The first one was like this. And inside, these big purple splotches.
There was more than just sadness. Even in the face of death in the hospital, there was community.
Every other Sunday, there is a party on Ward 5B. The hostess is a travel agent named Rita Berger, but the nurses and the patients know her as Rita Rocket.
She came on an Easter to offer to do an Easter brunch. It went so well, it turned into like she would come on Sundays.
Those kinds of experiences produced a sense of camaraderie that persists even today.
Almost 6 million people are living with HIV and AIDS in South Africa. 66% of HIV-positive people are receiving treatment. Experts say tackling social issues like poverty, unemployment, and educating vulnerable women in sub-Saharan Africa can also help save more lives. The program to prevent mothers passing the virus to their babies was set up in 2001.
At first, I didn't believe that can happen, that I'm HIV positive, and then I can give a birth to a child that is HIV free. But then when I received the results, it was like, wow, I was screaming. Yeah, I was running, said, yo, my baby's safe, safe.
HIV-positive mothers are given antiretroviral drugs, or ARVs, during pregnancy and after birth. The drugs reduce the body's viral load, limiting the child's risk of contracting HIV through the umbilical cord or the mother's bodily fluids during childbirth or breastfeeding. Early detection is crucial.
Myanmar is changing quickly, but down this dusty lane is evidence of just how far the country still has to go. Hidden from view under decades of military rule, small HIV/AIDS clinics are struggling to survive. The former regime neglected the health sector like many others. But it's not just adequate funding that doctors and patients are crying out for, it's a change in attitude. Patients come here not just for treatment, but to escape discrimination.
Up until 2002, when someone died of an AIDS-related illness in Myanmar, the doctor wasn't even allowed to record on the death certificate that the patient was HIV positive. If they did, they could be thrown in jail.
Of the 120,000 people living with the illness, it's thought less than 30,000 are receiving the medication they need. Most of it comes from one international aid organisation, Doctors Without Borders. Around 20,000 people die each year as the disease spreads throughout families.
At first I was very, very sad, but now I'm quite used to being in this position. The doctors here give me a lot of support, and now my health is improving.
From husband to wife, mother to baby, it'll take more investment, education and recognition to slow down the spread of HIV.
It's no longer considered a gay man's disease now. We know that over time we found out that it also can be transferred in a number of other ways. So straight people also can get it too.
Teenagers are often inspired by the media to engage into sexual activity. Since the late 90s, the people with the highest HIV or AIDS count were people between ages 16 to 19. To this day, 1,000 teens are affected a day. Since teenagers are naturally irresponsible and easily influenced, a lot of unprotected sex can occur. This also includes the importance of one sex partner notifying the other of his or her disease, which often does not happen. This is illegal since you are taking someone's life without telling them, and you can go to jail. So if you are a teenager watching this, just remember, when you are walking through the halls of your school, just imagine 42% of those people are possibly infected with HIV without knowing, and motivate yourself to stay protected.
It occurs when bacteria infect the lungs and can manifest as coughing with bloody mucus. HIV and AIDS are not one and the same. Those with AIDS are infected with HIV, but people infected with HIV do not necessarily have AIDS. A person has AIDS when their T-cell count falls below a measurement scale of 200, as opposed to the 500 to 1500 in a healthy person. Before HIV can attack, it has to get in. HIV lives in bodily fluids like semen, vaginal secretions, blood, and breast milk. Candidiasis causes a white coating to form on the mouth, tongue, or vagina. This is called thrush. Other complications that lead to an AIDS diagnosis include wasting syndrome, whereby a person loses at least 10% of their body weight. Pneumocystis carinii pneumonia is a potentially deadly inflammation of the lungs that is one of the most common infections occurring in people with HIV worldwide. Two of these are cancers. One, Kaposi sarcoma, results from a tumor in the blood vessel walls and appears as disfiguring pink or purple lesions on the skin and mouth. The other cancer, non-Hodgkin's lymphoma, originates in the disease-fighting blood cells known as lymphocytes. One example is cytomegalovirus, or CMV, a herpes virus that healthy adults fight easily. In people with HIV, however, the virus causes damages to the body, most notably the eyes. If untreated, CMV can lead to blindness. Signs that HIV may be turning into AIDS include extreme fatigue, rapid weight loss, persistent diarrhea, a high fever, and swollen glands in the neck, armpits, or groin.
I knew someone years and years ago when they first came out discovering this. I knew someone whose brother died from it. And then I later on found out a friend of mine's, one of our friends when I was a little girl, one of our family friends' sons died.
Get sick more easily, the body can't attack off disease or germs, so then they end up dying.
AIDS is also diagnosed if the person has one of 26 opportunistic conditions.
Rarely, a person will contract HIV through blood transfusions. Once the virus is transferred, it attaches to its new host body CD4 cells, or T cells, which are integral parts of the immune system. Inside the T cell, HIV literally changes to become part of the body's DNA, or genetic code. At this point, the body will be forced to produce the virus.
I know it's sexually transmitted, usually. It can also be done through using drug users who use same IVs, and needles can pass it.
So the person I know that has AIDS is a very close person to me, and every day I watch them in pain, and it hurts, and they have to take so many pills to survive, and it's excruciatingly painful for me because I know this person.
It does still eventually run your body down, but I do know that with the medication that they give out now, you can live a longer, happier life and still do the things that you want to do.
Many modern medications can keep AIDS infections from progressing indefinitely.
Nowadays, it's very treatable. Nowadays, there's a push to make sure you get tested if you're not having safe sex. They do free testing. You go down to clinic.
Stop it, I guess you can say. It's like it prevents it from spreading, and they're supposed to like lessen the pain because it does hurt to have this disease inside of you, and it's supposed to lessen the pain, but some pills they just don't work.
It seemed like with the passage of time since the medication started working and the death rate started to go down, it was a good time to look back at that era and try to make sense of what actually happened, what we actually went through as a community.
Millions of people die from AIDS, and millions of people are like in fear of having AIDS.
There are so many people today living with the disease and regret having it. There is not very much we can do about it, but treat it.
We're here now, and there's not that many of us here, and there's a kind of a very bittersweet feeling when one has that experience on the street.
Highly active antiretroviral therapy has caused the number of AIDS-related deaths to decrease significantly. Over 1 million Americans are infected with HIV because 300,000 people are still unaware of their HIV infection. Getting tested and making sure you know your partner's status is essential.
For all the people that we have lost through a very, very long time, we should pray for them. There are many faces, many different races, many different ages. Even though in this generation we have found a way to cure our patients, it is still very, very important that we do not catch this disease.